Do I
People
put
on security
the
can still
tube
watch
in
what's happening,
now?
by the way.
Because he's still unconscious, or
He's definitely unconscious. Can you guys not see him? What's up?
no? I do.
No, I can see him. I
Right,
can't
then of
access
course
him.
he's unconscious.
No, like no. Do I
Just
put
real
the
quick,
tube
those
in?
on security, you don't actually have to stand on security. You can literally watch what's going on. It was just
Do
a
I-
roleplay thing.
Just keep checking the airway, buddy.
Yeah,
Okay. I
that's
don't
your
put the tube in if he's
responsibility.
unconscious though.
I can't touch him.
Alright,
Oh, now I
I'll
can.
do CPR. He's got no pulse.
Checking the vomit.
Managing.
His airways are still not clear.
What's he got?
Airways are. Oh no, they are clear. No medical suction needed. Oh, okay, sorry, I misread that.
Is it... Use the medical menu. Don't actually do the thing, because then it'll tell you what's up.
Okay.
Yeah, I can't get access
So-
to Rusty's body.
You gotta touch him in his balls.
Just drag me out of the corner.
Yeah, you can give him a drag and a release if you want.
Yeah, just okay, guys. Stop intervention. Drag him to the corner. Whoever can. Drag
You
him
see
to
him?
the nearest
Yeah,
corner.
I see
Yeah,
him.
I see him.
I've seen him the whole time.
So Zeph, keep in mind you've been thrown the deep end here. Feel free to ask questions, dude, as to what's going on, what's
Right.
happening, what things mean.
Nobody should touch the
What are the new
patient.
things?
I'm checking airways.
Nobody should touch the patient.
Someone did not stop the bleeding.
Zeph!
Whoa!
Alright,
You gotta
perfect.
remember, Zeph wasn't here at the start, so he's not actually fully aware of what's gonna happen when you shock him. When you shock me.
Alright, all good. Someone deal
Right,
with that
okay.
leg, please.
Yeah, I'm dealing with the leg. All right.
Alright,
His
Dave,
airways are still clear.
you may be on security, but fuck me, can you not just sit right
Sorry.
there?
That's my
Thank
bad.
you. Alright, perfect. Doing CPR again. Yoshi, can you push Epi, please?
Pushing Epi in his left arm.
Alright, so
Alright.
Dank, they've added airway management, defibrillator, and vital management,
Okay, I'm
well,
stitching.
monitoring.
He's got a
As-
fatal amount of blood.
Perfect. Someone put in. I'll put in another 1,000.
Yeah.
So the basics of ACE Medical are the exact same. So you got the same wounds. Well,
Wounds are clear,
to a
yeah.
degree, you've got the same wounds. You've got the same treatments for any of those base things.
Unit.
Yep.
Medical airways are clear, but medical suction needed. So
Alright, perfect. Do you have an Acuvac?
yes.
Alright, no one should touch the patient. So whenever you hear the AED charging up like this,
Yeah. Just don't touch the patient.
yeah, cancel your interaction as well, just to be safe.
Yeah, I did.
Yeah,
Hopefully
you
should be
will
calling.
get
You're gonna
injured.
shock just a few seconds before you do. That way they have got a little bit of time to say, "Yep, it's 2 seconds," or
And
"Yep,
I'm in
just finish
pain.
this."
I wasn't even fucking touching him, but alright.
Alright, you may have been close. I don't care.
Do I
Any...
Acuvac him now?
Yeah, go for it. So Zeph, what Yoshi's doing right now is he's clearing out either blood or vomit or something from the patient's airway, right? Now he's using a suction kit to do that, called an Acuvac. If you've seen what medical suction looks like before, it's literally either a hand pump or an actual little ventilating
Zeph?
thing.
Zeph, if you look at his head now, you can see the options for it. So if you press check airways, it should still say airways are clear and no medical suction needed.
Okay.
Right, his SpO2 is drastically low. Can you intubate him, please?
Yes.
Alright, insert some kind of airway management tool, be it a Gudgel
A
tube
tube, okay.
or a King LT.
And I'm setting the tube.
King LT is by far the superior one, but it takes longer to insert.
I don't. That's the only one I got up now. So, it says on the top left. as well.
Perfect. Zeph, go ahead and look into the actual patient using the medical menu, not the interaction.
That's what I've been doing, yes.
Terrific. You see in the bottom right the red numbers that are refreshing every 4 beats. So that gives you a live update from the AED. No one should touch the patient. Shocking. Of what's going on. So SpO2 is blood oxygen saturation. If they're not breathing properly or their airway is obstructed, that's going to keep going down. Anything above 90 or 95 is fine. If it's 90, you can expect that there's something wrong. It's probably occluded. Patient has got a pulse back 129. Perfect. Blood pressure is still very low.
Why am I in pain?
Because
You're
you're probably
closer
near
than
too
the
close to the
AED.
zone.
Oh.
So just on the SPO2 thing, in the real world, yes, 1995. In CAT, with the Wasenza we've got set up, it's about 70. It's to be a little bit
It's
more forgiving,
falling,
so it's
by
not
the way.
too brutal.
Alright, perfect. Josh, check his airway, please. Sorry, Yoshi.
Checking airways, medical suction needed. Airways are clear. So AccuVac.
Thank you.
So the alternative to suction is head turn.
Oh, okay. Oh, I could have done that. Okay, right.
So for non-medics, the head turn will be their primary use if the medic needs them to give them a hand. But for the most part, the medics are best off managing airways whilst the others manage CPR at the time.
So
Eventually, you get to the point that you're competent enough to do all of it on your own when you feel comfortable. Don't rush yourself into that.
So we're not giving section medics who's about to have a heart attack. So are we giving section medics oximeters and not AEDs?
Correct.
Cool. Alright, perfect. So Rusty, I don't know the percentage chance for AEDs. What did you say? It was 80 something?
85%.
Alright. So Zeph, if your patient is in cardiac arrest, use your AED. As you can hear right now, can you hear the beeping?
Yep.
Okay, perfect. As you can hear, his pulse is fast. It's over 100 beats a minute. It's 123 if you actually look at the thing. His blood pressure is still concerning slightly, but that's fine. Hypertension is always fun. So the patient's conscious, so we leave him for a couple minutes as we do in, normal medical. If he's fine, we can remove all of our monitoring equipment, so we can just interact with his torso.
Just by the way.
Yes, you are.
No, I'm not. I can't move. I'm still black screen.
What?
Am I the only one that sees
He's,
it?
no, I
he's
see
definitely
that.
conscious. He just
What the fuck?
entered
Yeah,
his
okay, I
inventory.
see that.
He just
Because it's
entered
because the
his-
monitors on it.
Oh,
there he
shit.
goes.
Okay, no, he's definitely unconscious.
Yeah, okay, sure.
Oh.
Alright, I'm putting the AED back on him then.
Nice.
I removed the AED after you just entered your inventory, and you rolled onto your back.
Yeah, that was me entering Zeus.
Ah.
Airways.
Alright, perfect. So let's think of what it is. Let's go into his medical menu and assess our patient. His SpO2 is very low, so what's going
What's
on
the
with his
normal number?
airway? We want
Checking
if
airway.
if his airway is a-okay, it should
Medical
be
suction
hovering
needed.
around 90.
Cunningham. Sorry, I wasn't actually looking at it.
So you
It's
want to
fine.
do suction?
You
Possibly.
tried to remove the vomit. You tried to remove the vomit. Airways. Airway
Shit is
management
fine.
needed. Sending his head because he just came out of consciousness, right? So
No, he didn't. We're,
well, because I already had it extended his head before, but now it wasn't.
oh yeah, no, it'll reset itself.
Yeah, that's what I mean. Airway management.
How long
needed.
has he been out for?
I'm
Enough
placing a
minutes
tube.
for a cast.
I would say King LT.
SpO2 is
Airway
rising
management
again.
needed. No medical suction needed.
Alright.
What do I do now?
Find down reality. Guardian's already arrived on scene, and
Yeah.
section medics have been sent on their way, so they're not holding up the section. And that's the
Wait,
sort
what?
of plan it will be. If it does reach this stage, Guardian will have already arrived by now, in theory. Now I'm awake.
That was weird. Wait, it said airway management needed, but no.
Yeah, it's a bit funky. So basically, if it's above 70,
Yeah.
it has the ability to wake up regardless.
Oh,
cool.
okay.
So-
right, okay.
Zeph, he's currently conscious. So after a couple minutes, we remove our monitor. We make sure we've removed our oximeter, pulse ox, in case we've actually put it on. I did not. We can deal with pain management now. Once his blood pressure returns to normal, you're familiar with how to use morphine, I'm sure. We've actually got a couple more analgesics, probably some opiates. Can't wait to not steal those. What do we have? Oh, we've actually got TXA. Are we actually using that?
Painkillers.
No, TXA is not a painkiller. It's a
know
clotting
what it is.
agent.
Wait, what is
Oh.
it?
Yeah, TXA. You'd use it in a patient with severe hemorrhaging.
Yeah, but, where is it? I haven't actually seen that in the arsenal before.
Hang on, I'll go find it. I
Not
didn't
even
pick
listed
any
in
up.
the wiki.
Seriously?
Yeah. Because all the stuff that's in that kit is the stuff that's on the wiki minus the AEDs and the IV stand.
What? Oh, do you have the pharmaceutical add-on?
No, I couldn't find it. I was trying to find it, but I couldn't.
I'll link you up. All good. All right, TXA was clearly in that instead.
Yep.
Yes,
Other
But yes.
surgical kits are one-time use.
Yes, so surgical kits have been switched to one-time use as of last week.
oximeter.
Man.
Anyway, Zeph, much like CLS, there will be a slideshow to accompany this. It is in the TS. I will resend it so you can see it.
Don't worry about the letters on it. Like, I created this for our old unit. It just hasn't been updated to 207 yet.
Which is what
Evacuation.
Hunic will be doing tonight.
Yeah, I've just been reading through it whilst we've been here.
All right.
Yeah, there's only like
Yes.
5-6 slides which are actually important to us.
Yeah.